Before you answer your next NCLEX question, stop. If you don't know these 5 priority rules, you're setting yourself up for trick questions and lost points. Welcome to RN Path Academy, your home for High-Yield Nursing and NCLEX Mastery. Today, I'm breaking down the top 5 priority rules that separate passing from failing, and I'll show you exactly how to apply them. Let's begin. Rule number 1, the ABCs. When in doubt, always go back to the ABCs: airway, breathing, circulation. If the patient has an airway problem, nothing else matters. Look for keywords like stridor, drooling, wheezing, respiratory distress, unresponsiveness. Those all scream airway first. Mini example: patient with an open fracture and a patient with severe wheezing. The priority, the airway every time. Rule number 2, Maslow's hierarchy. After ABCs, think Maslow. Physiological needs come before safety. Safety comes before love and belonging. And all of those come way before teaching or psychosocial needs. If the question asks, which patient do you see first? Start with physiological instability, trouble breathing, extreme pain, active bleeding, abnormal vital signs, acute confusion. These always outrank emotional needs or education needs. Rule number 3, acute versus chronic. NCLEX loves this rule. The acute patient is your priority. New pain, new confusion, sudden change in vital signs, post-op complications, those come first. Chronic conditions like COPD, baseline shortness of breath, long-term back pain, stable hypertension are important, but not priority unless something changes. Ask yourself, is this expected or is this new? New equals priority. Rule number 4, unstable versus stable. Unstable patients always come before stable ones. Unstable looks like abnormal labs, new onset symptoms, post-op less than 24 hours, unexpected findings, high fever, dropping oxygen levels, active bleeding, new neuro changes. Stable looks like expected pain after surgery, routine care, long-term conditions at baseline, predictable recovery. If you ever feel stuck between 2 options, choose the unstable one. Rule number 5, don't delegate what you should do. This rule alone saves people hundreds of points. If the patient is unstable, new, critical, or requires assessment, teaching, evaluation, or clinical judgment, you, the RN, must handle it. Delegate only stable, predictable tasks to UAPs: bathing, feeding stable patients, ambulation, routine vitals, hygiene, turning and positioning. LPNs can handle. Chronic conditions, stable patients, predictable outcomes, medication administration, not IV push, wound care, reinforcing teaching, but not initial teaching. Remember this line: if it requires teaching, assessing, or evaluating, the RN must do it. Let's put it all together. When you get a priority question, look for airway, then physiological over psychosocial, then acute over chronic, then unstable over stable, then decide if you can delegate or not. Follow that order and you'll start answering NCLEX priority questions correctly every single time. You're learning how to think like a nurse, and that's what separates safe practice from guessing. Keep going. You've got this. You're not just memorizing rules. You're learning how to think like a nurse. If you want more high-yield NCLEX breakdowns like this, hit subscribe and join the thousands of future nurses mastering their path, one high-yield lesson at a time.